We envision a city where all residents can flourish regardless of their race, ethnicity, income, gender, zip code, or immigration status. Dallas's leadership knows this can only happen with a community-driven plan of action to improve residents' quality of life. That means collaborating with residents, businesses, and organizations to develop and implement data-driven policies that promote equity, inclusion, and resilience. It means working hand in hand across dividing lines that have historically kept us apart. The Resilient Dallas Strategy outlines how we can make Dallas a city of opportunity for everyone. 3 notable goals are to make Dallas a welcoming city to immigrants, leverage partnerships to address behavioral health, and alleviate adverse environmental conditions by promoting sustainability. As the first certified welcoming city in Texas, Dallas has reduced barriers and created opportunities for immigrant residents by expanding language access across city services, supporting families by creating a resilience fund during the global pandemic, and offering legal services. Dallas's approach to divert people experiencing mental health crisis from jail or unnecessary hospitalization is quickly becoming a national model. It's called Right Care. With the right people, primarily a social worker, paramedic, and police officer, answering 911 calls, mental health patients are receiving the right treatment. Dallas's award-winning Comprehensive Environmental and Climate Action Plan, or CCAP, is constructing buildings that are energy efficient, installing solar, reducing emissions, converting the light-duty fleet to be electric, and using cleaner fuel for other vehicles, protecting water resources, and increasing access to healthy local foods from urban farms and gardens. We are an all-American city and a community for all.
We are One Dallas.
We are all one Dallas.
Good afternoon, everyone. Welcome to All Dallas Eats, a conversation around equitable food access. In case we have not yet met, I am Susan Alvarez, and I'm currently serving as the Assistant Director of the City of Dallas Office of Environmental Quality and Sustainability. I'm so glad you've joined us for this conversation as a part of the Big Bang Innovation Summit. With the overall theme of the new economy, healing our divides, today we will be hosting a conversation around equitable food access. Dallas has known for years that we have a challenge with U.S. Department of Agriculture-defined food deserts, and there are numerous efforts underway by both public and private sector entities to address this challenge. However, during the COVID-19 closure, we've also learned that we have hundreds to thousands of households who are also one paycheck away from a food line. And so we have a better understanding of how vulnerable our community is and how we have some supply chain challenges around food. This panel today will be exploring opportunities and constraints around equitable food access in Dallas. So I am pleased to introduce 3 ladies who are my friends, colleagues, and now co-panel members. First of all, we're joined by Vidya Ayyr, who leads high-impact interventions to address social determinants of health with a commitment to health equity and improving the lives and livelihoods of disadvantaged, marginalized, and vulnerable populations. As the Director of Social Impact for the Parkland Health and Hospital Systems, she provides strategic oversight to Parkland's community outreach investments, promotes innovation in data analytics, and mobilizes a team of community health workers to drive an integrated approach to population health management. Applying her background in human-centered design thinking, Vidya has inspired a series of patient-centered care advancements, such as advancing the first forum for patients to inform decision-making practices at Parkland. Prior to this role, Vidya was a part of the external affairs at Parkland, where she developed public-private sector partnerships to support diverse, multi-stakeholder initiatives. Vidya also serves on the National Brain Trust, the Community Leadership Forum with the Federal Reserve Bank in Washington, D.C., and is a presidential scholar with the George W. Bush, William J. Clinton, George H.W. Bush, and Lyndon B. Johnson Foundations. Her work on social impact collaboration was recently recognized by the National Root Cause Coalition for its merit as an innovative design framework and by the Institute of Patient and Family-Centered Care. Ms. Ayyr holds a Bachelor of Science degree in Business Administration from the University of Texas at Dallas. She also earned her Master of Public Health degree from the University of Texas Health Science Center School of Public Health in 2011. One of my colleagues from the city of Dallas, Heather Lepeska, is the interim assistant director for business and community development in the city of Dallas Office of Economic Development. She currently oversees the business development staff and the department's programs related to community development, including the Dallas Development Fund, DDF. That fund operates the city's New Markets Tax Credit Program. They also operate the Healthy Food Dallas Initiative, which provides funding for low or no cost food access programs to nonprofit organizations. Prior to her arrival at the city of Dallas in 2005, she also worked in Washington, D.C. for Congressman Jerry Costello, serving as his legislative director. In that position, she was responsible for legislation and policy matters related to transportation, trade, appropriations, and budgets, among other subjects. Heather received a master's in public policy with a focus on public and private policy and management from the George Washington University and a BA in American Studies from the University of Notre Dame. Last, but certainly not least, and I put her last because she has the most stuff, is Meghna Tare. As UT Arlington's first Chief Sustainability Officer, Meghna works collaboratively to foster partnerships among academic, research, and operational departments at UT Arlington, and to address opportunities to promote sustainability in several areas, such as energy efficiency, waste management, transportation, education, outreach, community engagement, and interdisciplinary and sustainability-focused curriculum. I told you she has a lot. So she has also spearheaded launching a regional center of expertise for education in sustainability development goals in North Texas, a program of the United Nations University and the Institute for Sustainability and Global Impact at UT Arlington. She's also serving on several advisory boards on behalf of UT Arlington, including but not limited to the National Academy of Sciences Board on Higher Education and Workforce Development, Policy and Global Affairs, Association for the Advancement of Sustainability in Higher Education, and she serves on the board of directors for International Council for Local Environmental Initiatives. She is a TED speaker, was featured as the Woman in CSR awarded Women of the Decade in Corporate Social Responsibility by the Women's Economic Forum, and the 2020 Women in Sustainability Transformational Leader by Wells Fargo and Envision Charlotte. She graduated with an MBA in Sustainable Management and a Master's in Environmental Science and another Master's in Chemistry. So with that, that's my fabulous team today. I'm so glad these talented women have agreed to join us. And with that, I would love to start our conversation. I would let you know we will hold the chat open. And so if you have any questions for myself or my colleagues, kindly put them in the chat and we will try to get to as many as we can. So starting in, the first question I have, and it's for each of my panelists, can you do just a really quick overview of how your respective programs are helping to bring equitable food access?
I can go first, Susan. Okay, hi, thanks. Thanks for having me. And I'm glad to be part of this panel and discussion. So like Susan mentioned, I work with UT Arlington, and it is a city in itself, right, with our own operations, police, parking and transportation, 420 acres campus with a $17.1 million impact in North Texas, right? So our presence is felt not just within Arlington and Fort Worth, but Dallas as well. And for a campus that has 60,000 students, equitable food access is important for not just our students, but our community. So, we really pay attention to the fact that in 2019, a survey by Forbes put forward the fact that 39% of the students have experienced food insecurity at some point. That's a big number. I mean, if you're a parent or a mother like me, you understand how complicated that is. And I think the pandemic has only exacerbated the problem. So UT has done a few things, like we recently started a brand new food pantry on campus to serve our students. It was started by Student Affairs. We have an opportunity to receive a mixture of non-perishable food that we supplement with their monthly food costs. To address food insecurity for our students, we have a dining website and an app called Dine on Campus, which was launched last year. But the idea is that if there's excess food on campus, students who subscribe to the app get a notification, and we are able to not only reduce food waste but also help students on campus. So I really think some of those things that impact the student in everyday life is important for UT Arlington to address, not just within the community, but also outside of the community. And then we have a lot of programs and initiatives that are going on in collaboration with other organizations outside of UTA, City of Dallas being one of those. Thanks, Susan. You're muted, Susan.
Vidya, would you like to dive in?
Yes, absolutely. And so I think there's a very important connection, just like Meghna just shared. Dallas has a very large population. We're the ninth largest county in the United States, and with nearly 2.5 million residents. And then when you break that population down further, the population of Dallas County is about 41% Hispanic Latino, 28% non-Hispanic white, and about 22% non-Hispanic Black. And when we think about the Hispanic and Black populations account for a disproportionate number of people living in poverty within Dallas County. As part of our efforts in Parkland, which is the safety net provider for Dallas County, our community health needs assessment takes a really deeper dive into the trends and the needs of our population. And food insecurity is one aspect of that. The lack of reliable access to nutritious, affordable food really affects about 1 in 6 residents in Dallas. And so the food equity piece of this is so critical to the health equity piece. And it's heavily correlated with poverty. When we look at food insecure adults, they're more likely to be obese, have higher risks of diabetes, hypertension, certainly cardiovascular disease and chronic disease. So that component of health and nutrition becomes critical to the population health aspect of what we are focusing our efforts on. Additionally, those with food insecurity have higher rates of hospital admission and readmission, maybe also correlated with non-adherence to medical treatment. So when we look at the numbers, estimating just over 5 million Texans live in food insecure households. And a lot of that concentration within Dallas is in our southern sector. So we have launched efforts in partnership with the City of Dallas to be able to address the needs in that community. So the couple of things that we have done, and I would like to call out the two aspects of this, is to tackle it through one, traditional partnerships, and the second thing is to really invest in technology and innovation. And I know we're going to get to that piece of it further in the discussion, but through our traditional partnerships, we've been able to have a community garden at our Southeast Dallas clinic. We also collaborated with the Crossroads Community Food Bank, and they have a program where we actually provide health services as part of the food distribution. And then we also have what we call our access to care hubs. And we have one in the Inspired Vision Compassion Center, which is also a food bank, serving that southern sector population. And we provide weekly screenings and blood pressure, glucose, health information and navigation for any of the participants of the program, certainly any of our patients as well. When it comes to the innovation and technology aspect of it, Parkland has really invested some tools to be able to address how we can actually think of the future of food. And I will turn this back over to you, Susan, so we can talk a little bit more about the technology and innovation as we continue the conversation.
Can't wait. This is great. And I think you've done a great job of framing the why we're worried about food and really the ultimate impacts on our community. I would love if Heather, who leads some of the work the city is doing with the Dallas Development Fund, could maybe just briefly, because there's a whole lot there, provide some insights on some of the things that her program is doing. I think that would be a great add-on.
Sure, and I'm happy to talk about that. I also made the list of the things the city is doing. So, Vidya mentioned some of them, but I think, we have summer feeding sites and after-school programs through our libraries and our rec centers. We talked a little bit about education. The library does a lot of food education and health education. So I think we want to give some credit to the good public-facing work that they're doing. As you know, we just got through the pandemic money and we did some food delivery services and some home garden programs with that pandemic money. And then you're working on the urban ag plan that will, really look at food growing in Dallas. And so I think we want to throw that out there too, about programs that are looking at equitable food access. Through Dallas Development Fund, through DDF, we've awarded about $750,000 over 2 separate award cycles. And it's really funded a very broad range of different types of programs. So it's looking at, we didn't tell anybody what was eligible, basically. We said, you need to provide free or low cost food to the population. And we're not saying that it had to be bricks and mortar. We have rolling trucks. There's some that are growing focused. There are some that is, reclaimed food and repurposing it so you're avoiding waste. There's a ton of different distribution programs, like Four Oak Cliff is building a new food distribution hub at their new location on Ledbetter that we just funded. Sharing Life, we're talking about innovation a little bit later, is launching an app to facilitate picking up your food when it's convenient for you. We partnered with Baylor Scott White and they're doing some veggie prescriptions and their WIC stands. There's a $double program. Grow North Texas needed a washing station to wash their produce to make it better to go to market. So that was something else we funded. So all that to say, we've done 12 awards. So I could go into a lot of details about a lot of different programs, but I think it's really a good way to not invest a ton of money and everything had to have matching funds, but to really be able to say you had a pretty good impact. So that I didn't really answer your initial question, but I think I answered your second question you threw at me. So there you go.
I think, thank you. I don't know that most people know how much the city is already doing before we do the comprehensive plan. And you're right, it's through several departments' efforts. And so I'm appreciative of you sharing that information. Since Vidya has teased the innovation question, I'm going to go there. So the focus of this summit is on innovation. How can technology and innovation be used to help Dallas residents have equitable access to food?
I'm going to jump right into this. And I'm sorry, is that okay if I jump in? Because I'm so excited to share the exciting work that we are doing in that space of innovation. So some of you may be familiar, certainly the other members of this panel may be familiar with the fact that Parkland, during the pandemic, recognizing the need, partnered with our Parkland Center for Clinical Innovation. And we created something using machine learning and called it the Proximity Vulnerability Index, whereby using geomapping and hotspotting for COVID-19 positive patients, we were able to generate a dynamic personal risk scores for individual patients, including their risk of being infected or potentially the severity of the disease. And we partnered with a Dallas County Health Department to get their data feed and really sensitively detect and really think through how we can do the interventions and reduce the risk of the spread of COVID-19. What this presented was an opportunity for us to then think of who are or what populations are the most vulnerable when it comes to the spread of the pandemic. And in addition to that, when we start thinking of individuals who may have come into contact with COVID-19, what we ended up doing, which I thought was a really creative program, was to also trigger an additional question and response. When we were able to identify someone who might be self-isolating for the 2-week period of being exposed to maybe COVID or is at risk, what we did was ask them the additional question, which is an evidence-based food insecurity screening question formulated by the USDA. But we sent that out to them and said, within the past 12 months, the food you bought just didn't last, or you didn't have enough money to get more. And it was kind of a yes or no response. If they on a sliding scale, and all of this is the data and the technical piece, but if they screened positive for food insecurity, that triggered a response for one of our community health workers to call them and enroll them in services, certainly like Heather mentioned, a partnership with the city of Dallas allowed us then to send a 2-week supply of food to their home, delivered to their home, which helped with the self-isolation, it helped with food insecurity, it helped reduce the spread of COVID because that individual was not going to the grocery store or going to their food bank and spreading it across the vulnerable community. So that's the power of technology. And to your question, Susan, of what are some of the ideas that we can offer to continue to innovate in that food world, I say interoperability. We really need to identify opportunities to strengthen data and digital interoperability across our sectors of agriculture and food and public health and government, really thinking through how we can be informed in our decision making. And that goes into 3 buckets: data collection, data sharing, and data use. If we can really be thinking about how we can look at our data and use data for good, I think that will help us with the innovation process. And certainly, like this pandemic response with our vulnerability index, it took a lot of partners and a lot of coordination and a lot of innovation and data in order to be able to assist all of our patients in our community.
That is wonderful. Meghna or Heather, would you like to add into this with some of the things you guys are doing?
Yes, absolutely. Can you hear me all right? Okay. Yeah, I mean, UTA, we are an educational institution, we are in the business of education. So this is our expertise. We are in the world of data, and nobody speaks data, technology, and research like an academic institution, right? So we do have a couple of research projects that are going on at UT Arlington with some faculty experts. I can give 2 or 3 examples. The first one is there's a team of UT Arlington researcher working with UTD to monitor greenhouse gases from farming to save the farmers money. We are in the world of conversation about climate change, and COP26 is happening next week. And, climate change is sort of driving all the conversations that we are having. So why not farming, right? So UTA researchers, they have a funding from USDA, a grant, 265,000 grant, and they're putting sensing system that can be used on farms to detect greenhouse gas emissions, which is a major factor in climate change, but also helps with the production. And so that system is in place. There's another research project which is led by Gautam Das, a professor at Electrical Engineering, College of Engineering. What they are doing is they are developing these tiny sensors that you can attach to insects, and that those sensors will track their movements and life cycle. And it is in an effort to combat infestations in the farming and the production and increase the farm produce. So, again, that project has been funded by USDA and has been happening for the last 2 years at UT Arlington. And then we are in the Internet of Things era. Everything is about data and how we can use technology and data to improve our services, including supply chain. So if the recent few months is any example, we really need to fix our supply chain, be it from the chips that we are using to the products that we are consuming on an everyday basis, to the food that enters at a food shelf, right? So again, another grant that UT Arlington professors are working on in collaboration with a lot of organizations, and it's a USDA grant where we are trying to blend data with agriculture for improved production. So this is a research project happening at Industrial Manufacturing and Systems Engineering Department at UTA to explore how problems of getting the products to the market through collaborative transportation and the creation of virtual logistics communities. It's a really fascinating field. And, the professor who's working on this grant is actually working with farmers in 3 Texas regions who have already begun collaborating with her and in their communities to create better way to transport the food in Dallas. And so I think, UTA has been doing some of these research projects, which really helps improve the technology and sort of foster innovation, which can be scaled and which can be replicated. It does not have to stick to North Texas. Other regions can replicate the model. So I'm really proud of UT Arlington taking the lead in that.
That's really interesting. I wasn't aware y'all were doing that work. I think that is going to be really helpful. Heather, do you have anything you would like to add? I know that we did crowdsourcing for a while on ideas relative to food access. And I know that I think you're tapped in on some of these programs, or we collectively, the city, are tapped in on some of these programs to get food and using various forms of technology and actually information to get to people that are behind the proverbial digital curtain as well. Would you like to add anything on that?
Sure. I mean, we don't do original research, and we don't, do all the stuff that the previous panelists talked about is so much more research focused than what we're going to be doing at the city. But to follow up on the crowdsourcing idea, one of the ideas that came out of that was really looking at letting people who are getting their food at a food pantry have a more user-defined experience. And so Sharing Life is working with Brother Bill's Helping Hands in West Dallas to launch an app so that they can actually kind of order their food on their phone and pick it up at a time that's more convenient for them to avoid having to wait in line in the pantry. And this is something that has been used in Illinois, in Northern Illinois. So it's not the first rollout of the model, but there's obviously tweaks and everything that needs to happen. And that is something that DDF is funding. And when I talked to Sharing Life last week, they also mentioned that they're working with some other partners to potentially create, cold storage boxes where people can pick up their food so that they can go after hours. And so that eliminates some of the challenges with access being only during certain times and just makes the user experience better. Our department in economic development, we've supported a giant e-commerce facility. That's the Kroger Ocado facility where they use robots. And so it's like on the ground, and grocery store, not even a grocery store. It's not a grocery store. It's a delivery model. And it becomes the hub for a lot of different spokes. And one of the components that we required is that they provide delivery throughout the city of Dallas. so that everybody within the city of Dallas would be able to access this food delivery program. So the innovation is more in a different model. Instead of going to, you have to go to the grocery store, the groceries then come to you. And as a win for economic development, it's over $100 million investment. There's 400 jobs, but then it's also providing that food access that, our community needs.
That's like totally great. And again, you're quietly on your floor at the city doing these wonderful things. I want to continue with you, Heather, and maybe take a little bit different direction in the questions. In the great scheme of things, what do you see as the city's primary role in improving food access?
So, traditionally, I think the city's role is to be a convener and potentially to be a funder. That's really what we're best at. I think we also have ability to amplify. Like, we know our council is super good at, recruiting pitches and getting feedback from their communities. And, they have a soapbox and they use it, and that's great. And we want them to continue to do that. So what we really are going to be part of a solution. Like, we can never be the whole solution. So we need partners, within our department. When we're looking at projects, we can't be the only funding source for any project, and we want to fill the gap. So, we want to encourage as much creative thinking and as much, I don't want to define what a solution would be, but we need to have it be approached by multiple people. It can't just be, one entity. Because we really need a partnership to make our projects work.
Mm-hmm.
So it's really interesting. I was in a meeting the other day with our police chief, Chief Garcia, and he spoke very eloquently, and then I hit Google afterwards, but he was talking about the role that food insecurity plays in serious violent crime. And it was interesting to me because I didn't see food security in that light as being, if you address food security, you're addressing some of the other major community issues. I'm curious, Vidya, what roles can public health providers play relative to encouraging healthy food access as a prescription to addressing chronic disease?
Certainly, that's a great question, because I think the idea of public health, nutrition, and food as medicine is something that I think we're exploring, and we're seeing more and more of, prescriptions for health. And I know that Parkland had been looking into a program like this. Certainly right before the pandemic hit, our priorities changed a little bit to try and look to seeing if we could have an on-site food pantry, or having an on-site, we were doing the farm stand at our Southeast Dallas center, but looking at options for the availability and creating access in a public health setting. I think having the infrastructure as large as the health system is, we are more than just the hospital. We have clinics that are embedded within the community. So to really be able to partner with the community and to bring access in to those areas, I think the piece of health, and that plays a really big piece, is the education aspect, right? I think we can do more with really understanding how people eat, where they get their food, how they can make healthy options for low cost. And that is something that having our community health workers, for those of you who may not be familiar, the community health workers is a program that is really embedded. We hire from the communities we serve. So we're embedded within the community. It's a grassroots movement. So they know that the corner store may or may not carry almond milk. And so we really need to think through what are we talking about when it comes to the health of a patient? How is it different to managing a chronic condition or diabetes, or versus preventing that? And so really getting the next generation involved. And also looking through culturally sensitive ways in which we can do food education. That's a big piece that we are focusing on as a health system, of thinking through the food equity as it pertains to health equity.
Thank you. I've got a question now for Meghna, and it's along the same line of questions relative to roles. So how can institutions of higher education support the regional food systems through education or research or collaboration? Can you expand on that a little bit?
Yeah, absolutely. And I think Heather and Vidya touched on it, right? Heather mentioned the fact that we cannot do it alone, right? We need other peoples to pitch in and be part of the solution. And Vidya mentioned education, right? So I think that's where UT Arlington and academic institutions really step in, because this is a region that's growing, right? We are expected to have 7.2 million residents by 2050, right? So in a changing scenario with increase in the population growth, how are we going to fare with the diverse population projections that we have and the social, environmental, and economic challenges that we are going to have? And food insecurity is not just about food insecurity. It's a variety of problem, right? Transportation is as big of a problem as access to healthy food. It's part of the conversation about equity. Education is a really big problem. Supply chain is a really big problem. So I think UT Arlington or academic institutions can really help step in and be that bridge, be that collaborative arm that brings everybody together, local governments, nonprofit organizations, farmers, growers, food banks, to educate the people. I mean, the fact that we are here, 4 of us work in this area, but there was still so much to learn, right? Imagine if you bring everybody together in the region, and the exchange of ideas and the sharing and the collaboration that will happen based on what research we are doing, what innovation Parkland is doing, and what policies and programs that the city of Dallas is adopting. There is so much room to learn and grow. And I think we really bring that collaborative nature of the education aspect of it, where you have to educate, right? Because I think unless you tell people what is causing climate change, people don't pay attention to it. Unless you tell people this is the problem with food insecurity, people don't change their behavior. So I think UT Arlington and academic institutions can really help be that arm that connects everyone.
Thank you. We have a question in the chat that's directed at you, and I think it ties into the information you just provided, and that is, can you elaborate on any future programs that UTA may be looking at to bring as student interests around community inequities, data, and climate change evolve? As you know, the food realm has about 40% of the emissions worldwide are tied with food development, and actually, as we've seen in California over the summer, as we've seen right here in Dallas, that sector is really also vulnerable to climate.
Yeah, absolutely. And so research is definitely one aspect of it, but the North Texas Food Policy Alliance that we launched earlier this year, the idea is to bring the youth in the conversation and the students in the conversation and give them a chance to be part of this, challenges that we are addressing, through the youth network. UT Arlington launched a food recovery network earlier this year, which is a completely student-led chapter started by the student group, where what they are doing is picking up the leftover food from the cafeterias and Tuesdays and Thursdays at the end of the day, and taking it to Arlington Life Shelter, right, for food donation, so that it's not going to waste, but somebody else who's in need of it is using it, or having access to it. We are launching another United Nations Association chapter at UTA. It's done. It's completely launched. Again, a completely student-led organization that is devoting towards how can you adopt the UN SDGs, the United Nations Sustainable Development Goals, especially SDG 2, on campus and work with the community, not just the students, but also the faculty and the staff. So on April 17th of next year, close to Earth Day, UT Arlington is hosting a hunger banquet. We are going to invite 200 students to the banquet. The idea is, again, education. I'm a firm believer that education drives these conversations. So the idea is we bring students to this hunger banquet, we give them tickets, and we split 200 students into different sections. There's a table where students get chicken and rice, because they are coming from a developed part of the world, and there's a table where they just get beans because they're coming from a developing world. So the idea is, how do you educate students about the inequalities in the food system, and what do they learn from it, because they are the ones who are going to take it to their future places of employment or their home, right? So educational efforts, research, student-led organizations, and then the dialogue, the NTFPA dialogue that we have been having, bringing people together to collaborate on projects. The fact that we have applied to a USDA funding to do regional food assessment study, right? There are many opportunities like that. And if we get it, students can be part of it. They can help with the data collection. They can do the research. They can do the analysis. We hosted the UN Food Summit earlier this month, where we had such amazing conversation. You were on the panel talking about what North Texas as a region needs to do to address these challenges. And education and collaboration was a big part. And of course, climate change, you can connect everything to climate change, right? Food, water, recycling, right? So all of this becomes part of that conversation about climate change. And I hope that answers the question.
No, I always get so inspired when I hear about all the different things that my partners in the community are doing. I'm going to throw this out and anyone can answer it. And that is, how can we strengthen public-private partnerships working so that we make use of that synergy towards addressing those food-related challenges in Dallas? And any or all can dive in on that. I'm curious.
I can speak to it. I mean, with the North Texas Food Policy Alliance that we have launched, the idea was collaboration. The idea was bringing together, because Dallas is such a big region, but you have your own challenges. Fort Worth has its own challenges, Arlington, Denton, Louisville, Farmers Branch. And then, we have COG, North Central Texas Council of Governments. They adopted the plan, the Vision 2050, which was adopted, 10 years ago. And, at that time, 10 years ago, when we did the Vision 2050, we had included in the document that the region needs a food policy alliance or a council, and we need to work towards, this collaborative nature and public-private partnership. So even though we are too late to the game, we are using those recommendations and launching this alliance where we bring people together, host seminars, conferences, and come up with research papers or ideas for people to share and learn from. But also, I think giving a chance to the youth is really important to me. Bringing them into the conversation really, really helps.
I would agree. Vidya or Heather, do you have anything to add?
Yes, certainly. And thank you. Meghna said it so beautifully. It is this power of partnerships. And I think that it's so often when we want something like health equity, food equity, we have a shared goal. I think the challenge always is in developing a shared agenda on how do we get there. When you bring so many different players from such different sectors to the table, which is absolutely necessary in order for collective impact to happen. But when you have that, you also need to be able to design programs and evolve programs with that human-centered design element in mind. So strategically planning programs and thinking through that patient and that client in mind, and then kind of working our way backwards when we start thinking through our agendas on how we're going to be able to make change. We really need to have the idea of there may be lots of different perspectives, a lot of different ideas at the table, but we're all working towards that shared goal.
Absolutely. Heather, do you want to dive in as well?
Well, it's going to just be a broken record. So I don't know if there's, much to add. And I know, Sue, you're working on the plan with UTA, and I know our Office of OCC is working with Parkland. So we're doing this, but I think to do it better, we probably need to amplify a little bit more. And even just on this, we've been on this for 40 minutes, I've learned so much more than what I knew when I started this call. And so that's the type of thing, the collaboration and just the information sharing that we need to continue, that I think we're hoping to, that would be the benefit of the food policy, not Food Policy Council, but the food policy. I wrote it down and I can't find my notes. But that organization.
No,
that's what we need to continue with.
Yeah. Can I just add one more thing, Susan? So, I think collectively as a region, what is our story? We need to tell our story, and we need to amplify that story, like Heather said, right? For not just people in Texas to know, but everybody else in the region to know, because I think we have so much going on. But instead of working in silos, if you bring everybody together and have a loudspeaker and tell that story, it's going to be much more powerful.
I would agree. I am looking at another great question that's in the chat from one of the folks that is listening in. And that is, as we increase the quantity and availability of food, how are we ensuring the quality of food is considering the intersection of health and quality of life? And I think that's a great question. And I'm open to anyone that wants to dive in and try to tackle it.
I'm going to jump in and just mention a really great collaboration we did with the city. And that is a great question, by the way, about quality. And I think quality of produce, having access to produce. So a really creative project that we partnered on was this home grow kit. Certainly during the pandemic, we found that, the activities like community gardens and gathering in spaces was something that we were trying to mitigate. And at the same time, there was a lot of degrees of social isolation and lack of access. And so the innovation came from the city side, and we partnered with being able to identify vulnerable individuals in the community to get a home grow kit where they could grow produce from their home. Even if you didn't have a garden or access, it was a countertop kit. And I thought it was so creative to be able to then bring in the elements of quality food and quality produce. A lot of individuals had never grown such herbs or hadn't grown their own tomatoes. And so giving them access to doing that, and then actually then consuming and eating what you have grown is part of that piece of teaching people, educating people, and creating access in an innovative way. And I think that we need to continue to do things like that, look at and explore how innovation and technology can play a factor in being able to deliver quality produce to individuals in our community.
I agree with that. I think that's a great insight, if you will. I am being told by our moderator that we are close to time. So just with the remaining time, we've got like a 1 minute, really quick, succinct, one thing that you would like to see the city do to improve food access. And Vidya, since you're on the big camera, I'm gonna let you go first.
Well, I think we're doing the work. And I think the more individuals in our communities get involved, stay involved, advocate, get your voices heard, vote. I mean, all of that plays a role of, and I think civic engagement is critical. So if it's one thing that I think that I want to leave you with is a call to action. So yes, the four of us are on this panel, and there's teams behind us that are working on this, but there's always a way for you in the community to get involved and to be a participant, an active participant. If this is something you care about, take action. And I think that that's what I would say to that.
Great. Thank you. Heather or Meghna?
I would just say, I think call to action is a great way to put it forward, right? Everybody has challenges. Nobody is perfect. Our region has challenges, but I think coming together to address it through collaboration and working together really helps. And I guess, for me, education and research and innovation and technology will get us there, just like we are transitioning to the world of EV vehicles, right? Hard to believe, but we are doing it. I think we will get there. But I just think that it takes a lot of work on so many people's part, but I think doing it collectively reduces some of that barrier.
Thank you. Heather.
Well, yeah, and I would say provide feedback, right? And make your voices heard, to comment, follow up on what Vidya said. Like, we need to know what's needed. And that's why I think when we don't have a one size fits all solution, I think that's a more sustainable and more, it's a better solution, right? There's not just one solution to anything. So make your opinion known, provide feedback to staff, provide feedback to council, participate in the urban ag plan as those public feedback sections go live. And we want to hear your voices and figure out how we can solve this collaboratively, because it's not just any one of us or any one of our organizations that are going to be able to do it.
Thank you. This is so great. I'm so grateful to Vidya and Heather and Meghna for joining me today, and also to everyone who signed in to listen a little bit more about food in Dallas. So we've had a lot of, pun intended, food for thought to take with us as we move forward on implementing related programs at the city and in our respective communities. Thank you so much for sitting in today.
Thank you for having us, Susan.